About 80% of people with heart disease, especially those with structural heart disorders, where the structure of the heart is not normal, don't get diagnosed before the onset of symptoms. And we've found that most people don't get a diagnosis because they don't have a reason to be referred for advanced testing. And often these conditions are missed even after symptoms develop for a long time because the symptoms are not specific enough for cardiovascular disease. We have invested a lot of resources historically in building expensive diagnostics and building a lot of therapeutic strategies. But if you cannot find people who have diseases early enough, you're really not leveraging these technologies effectively. The Cardiovascular Data Science Lab, or the CARDS Lab, is a lab that generates novel insights from existing clinical data using artificial intelligence. With the applications of AI, we have now built new tools to diagnose rare cardiovascular disorders that were harder to find or required really expensive tests. So we use something like a wearable device that people might have on their wrist, or a diagnostic thing like electrocardiogram that just takes stickers on your chest and somebody can get in any doctor's office. But using that to diagnose really advanced conditions. We're also building new tools to diagnose not only conditions that have happened already, but those that will occur in the future. So predicting risk of disease as well. What our group wants to do is to actually use AI to really affect change and change care and outcomes of patients. So what we did is we created these large, really well-characterized cohorts of people, which is just large groups of people with and without disease who had a simpler test before. And then we built new models using something called deep learning, which is just a novel toolkit that can extract really fine insights from simple data streams to find signatures of disease versus signatures of lacking a disease. And then now this included using a photo of an ECG. So I could take my phone, and just like how you would scan a check to deposit in a bank, we could actually take a photo of an electrocardiogram, just a piece of paper, and can diagnose if the heart's pumping blood properly or not, if the heart has deposition of a faulty protein or not. And all those things required us to be really innovative and creative and leveraging both clinical expertise and our expertise in data sciences. The real reason we have to build novel technology is to make sure that we just don't build it for the sake of publications or science, but to actually change patient care. What we are trying to do with the CARDS Lab is to take information that we can get from all data sources out there, learn signatures of diseases, but then also build the tools and technology needed to scale it directly to hospitals and health systems, the smallest clinics, the community hospitals out there everywhere in the world. It allows you to democratize access to technology that gets you the diagnosis early in the disease course. So we've built phone apps, we've built tools that run locally on small devices that can actually deploy these tools at scale in any resource setting.